Welcome back to Calm Mind and Healthy Body, our channel. Kidney health is crucial to our overall well-being, yet it often goes unnoticed until serious issues arise. Our kidneys filter waste, balance fluids, and regulate blood pressure. When they're not functioning correctly, the consequences can be dire, affecting not just our physical health but our quality of life as well. Unfortunately, kidney disease is often referred to as a silent killer because it can progress without noticeable symptoms until it reaches an advanced stage. This video will illuminate the alarming signs of kidney disease that everyone should know. Recognizing these early warning signs, such as persistent fatigue, leg swelling, or changes in urination patterns, is essential. Ignoring these symptoms can lead to severe complications, making it imperative to stay informed. Additionally, we'll discuss specific foods that can exacerbate kidney issues, helping you make better dietary choices. By understanding the importance of kidney health and the signs to watch for, you can take proactive steps to protect yourself. So, stay tuned as we dive deeper into this critical topic and empower you with the knowledge to safeguard your kidney health. Before we dive deep into the main subject, if you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell. Hence, you'll be updated on health tips, recipes, and wellness inspiration. I appreciate your support. 13 silent alarming signs of kidney disease. Kidney disease can be insidious, often creeping up on individuals without explicit warning. Here are 13 subtle yet significant signs that may indicate kidney issues. First, persistent fatigue is a common symptom. When your kidneys aren't filtering waste effectively, it can lead to a buildup of toxins, leaving you feeling drained. Swelling, particularly in the legs, ankles, or around the eyes, can also signal kidney problems, as fluid retention occurs when the kidneys struggle to eliminate excess fluid. Changes in urination patterns are another critical sign. This includes urinating more frequently, especially at night, or experiencing a decrease in urine output. You might also notice changes in the color or consistency of your urine, which can indicate underlying issues. Other symptoms include persistent itching, back pain, and difficulty concentrating. These signs are often overlooked or mistaken for other health issues like stress or aging. However, it's essential to pay attention to your body's signals. If you recognize any of these symptoms, don't hesitate to seek medical advice. Early detection can make a significant difference in managing kidney health and preventing further complications. Remember, your kidneys are vital to your health, so stay vigilant and proactive. Kidney scientist reveals the worst possible foods for the human body. Certain foods can be particularly harmful when maintaining kidney health. Experts highlight that foods high in sodium, processed sugars, and unhealthy fats can negatively impact kidney function. High sodium intake, often found in processed foods, can increase blood pressure and fluid retention, putting extra strain on the kidneys. This can exacerbate existing kidney issues and contribute to the progression of kidney disease. Processed sugars, commonly found in sugary drinks and snacks, can lead to obesity and diabetes, both of which are significant risk factors for kidney damage. These sugars can cause inflammation and insulin resistance, further complicating kidney health. Unhealthy fats, especially trans fats found in fried and packaged foods, can lead to cardiovascular problems, which are closely linked to kidney function. To support kidney maintenance, consider healthier alternatives. Opt for fresh fruits and vegetables, which are naturally low in sodium and rich in essential nutrients. Whole grains, such as brown rice and quinoa, provide fiber and help regulate blood sugar levels. Lean proteins, like fish and poultry, are better choices than red or processed meats. By making these dietary changes, you can significantly improve your kidney health and overall well-being. Remember, what you eat is crucial to how your kidneys function. Do this. 2 tablespoons before meals to stop diabetes and repair your kidneys fast. If you're looking for a simple yet effective dietary change to support kidney health and manage diabetes, consider incorporating 2 tablespoons of apple cider vinegar or flaxseed. These ingredients have health benefits that can significantly improve your overall well-being. Apple cider vinegar has been shown to help regulate blood sugar levels by improving insulin sensitivity. Taking before meals may help reduce the post-meal blood sugar spike, making it a valuable addition for diabetes patients. Additionally, its acetic acid content can aid digestion and promote a feeling of fullness, which can help with weight management. On the other hand, flaxseed is rich in omega-3 fatty acids and fiber, both beneficial for kidney health. The soluble fiber in flaxseed can help lower cholesterol levels and improve heart health, which is crucial for individuals with diabetes. Moreover, the anti-inflammatory properties of flaxseed may support kidney repair and function. Before making any dietary changes, it's essential to consult with healthcare professionals. They can provide personalized advice based on your health needs and ensure that these additions align with your treatment plan. Taking these small steps can lead to significant improvements in your health journey. Warning signs. Sick kidney. See how and what happens. Kidney disease often progresses silently, making recognizing the warning signs early crucial. Initially, the kidneys may lose their ability to filter waste effectively, leading to a gradual buildup of toxins in the bloodstream. Without intervention, kidney function can deteriorate over time, moving from mild impairment to severe kidney failure. This deterioration can take years, but the consequences can be life-altering. As kidney function declines, various complications can arise. High blood pressure is a common issue, as the kidneys play a vital role in regulating blood pressure. Additionally, untreated kidney problems can lead to anemia, bone disease, and cardiovascular issues, significantly increasing the risk of heart attacks and strokes. In advanced stages, patients may require dialysis or even a kidney transplant, which can be both physically and emotionally taxing. This highlights the importance of early detection and regular health checkups. Routine blood tests can help monitor kidney function and catch any abnormalities before they escalate. If you notice symptoms such as fatigue, swelling, or changes in urination, don't ignore them. Seeking medical advice promptly can lead to timely interventions, improving your chances of maintaining kidney health and preventing serious complications. Remember, proactive care is critical to safeguarding your kidneys. Chronic kidney disease, CKD, is a long-term condition characterized by a gradual loss of kidney function over time. It is typically classified into 5 stages, ranging from mild damage, stage 1, to complete kidney failure, stage 5. In the early stages, individuals may not experience noticeable symptoms, but as the disease progresses, complications can arise, including high blood pressure, anemia, and bone disease. Common risk factors for CKD include diabetes, hypertension, obesity, and a family history of kidney disease. Lifestyle choices play a significant role in the progression of CKD. Poor dietary habits, such as high sodium and processed food intake, can exacerbate kidney damage. Additionally, a sedentary lifestyle and smoking can further increase the risk of complications. Conversely, adopting a healthy diet rich in fruits, vegetables, and whole grains, along with regular physical activity, can help slow the progression of the disease and improve overall health. It's essential for individuals, especially those at risk, to monitor their kidney health regularly. Routine checkups and blood tests can help detect early signs of CKD, allowing for timely interventions. If you have risk factors or notice symptoms like fatigue or swelling, don't hesitate to consult a healthcare professional. Taking proactive steps can make a significant difference in managing CKD and maintaining kidney function. Polycystic kidney disease. Polycystic kidney disease, PKD, is a genetic disorder characterized by the growth of numerous cysts in the kidneys. These fluid-filled sacs can disrupt normal kidney function, leading to complications such as high blood pressure, kidney stones, and, ultimately, kidney failure. PKD can significantly impair the kidney's ability to filter waste and maintain fluid balance, affecting overall health. The genetic nature of PKD means that it often runs in families. There are 2 main types: autosomal dominant PKD, ADPKD, which is more common and typically manifests in adulthood, and autosomal recessive PKD, ARPKD, which is rarer and usually presents in infancy or childhood. For individuals with a family history of PKD, genetic counseling is crucial. It can provide valuable information about the likelihood of inheriting the condition and help families understand their options for monitoring and management. Living with PKD requires proactive management strategies. Regular checkups with healthcare providers are essential to monitor kidney function and manage blood pressure. Lifestyle adjustments, such as maintaining a healthy diet low in sodium, staying hydrated, and engaging in regular physical activity, can help slow disease progression. By understanding PKD and its implications, individuals can take steps to manage their health effectively and improve their quality of life. Kidney stones. Kidney stones are hard mineral and salt deposits that form in the kidneys, and they can be pretty painful when passing through the urinary tract. There are several kidney stones, including calcium oxalate, uric acid, struvite, and cystine stones. The formation process typically begins when the urine becomes concentrated, allowing minerals to crystallize and gradually grow into stones. Factors such as dehydration, certain medical conditions, and dietary choices can contribute to this process. Preventing kidney stones often involves making specific dietary and lifestyle changes. Increasing fluid intake is crucial, as staying well hydrated helps dilute the substances in urine that lead to stone formation. Aim for at least 8–10 glasses of water daily. Additionally, reducing sodium intake can help lower calcium levels in urine, decreasing the risk of calcium stones. Limiting foods high in oxalates, such as spinach and nuts, can also benefit those prone to calcium oxalate stones. Encouraging viewers to stay hydrated is essential, as proper hydration is one of the most effective prevention strategies. If you experience symptoms such as severe pain in the back or side, blood in urine, or persistent nausea, it's essential to seek medical advice promptly. Early intervention can help manage kidney stones effectively and prevent complications. We discussed how symptoms like fatigue, swelling, and changes in urination patterns can indicate kidney issues that should not be ignored. Additionally, we highlighted the importance of steering clear of foods high in sodium, processed sugars, and unhealthy fats, which can exacerbate kidney problems. Being proactive about your kidney health is crucial. Regular checkups, staying hydrated, and making informed dietary choices can significantly impact your overall well-being. Remember, early detection and lifestyle adjustments can help prevent serious complications. We encourage you to engage with our channel if you find this information helpful. Please subscribe, like, and share this video with friends and family who may benefit from learning about kidney health. Your support helps us create more valuable health-related content and reach a wider audience. Together, we can raise awareness about kidney health and empower others to take charge of their well-being. Thank you for watching, and stay tuned for more informative videos.